So hello everybody. Today we're talking about the importance of take care of the health when we have diagnosis with prediabetes. Pre- Prediabetes is a condition that describes abnormal blood sugar levels. It is diagnosed when someone's blood sugar levels are higher than they should be. Do not qualify for diagnosis type 2 diabetes. It can be considered precursor to diabetes. It is also not impaired glucose tolerance and impaired fasting glucose, but these terms are less common. So why is prediabetes important? Because people with the prediabetes have a high risk of developing type 2 diabetes. Prediabetes increases the risk of heart disease and stroke. But when diagnosis and treat early, people with prediabetes can reverse the condition in their life or even stop developing diabetes type 2. Causes. Prediabetes is caused by some problems with insulin that can eventually lead to type 2 diabetes. The body needs insulin to remove glucose. So the body can use the energy. If there is not enough insulin, the glucose stays in the blood and cannot be used by the rest of the body. Diabetes develops two reasons. The insulin the body naturally produces enough. The body and insulin meaning does not insulin properly. Like diabetes type 2 or prediabetes can get any age, but is most often develops later in life. There is a genetic link, but other factors play a huge role. Obesity, diet, and light exercise. How can we get the diagnosis? There are several blood tests using the diagnosis prediabetes. They are the same tests used to diagnose diabetes type 2. The results and the degree to which they are abnormal. So these labs determine whether you have normal sugar regulation, prediabetes, or diabetes. These tests are fasting glucose, measure your blood sugar levels when you have fasting for 8 hours. A normal result is less than 100 milligrams DL. Prediabetes is diagnosed if the result it is 100 to 125 mg. Oral glucose tolerance test. This is another test. Test your body sugar level 2 hours after you receive a specific amount of sugar. A normal result it is less than 130 mg. Prediabetes is diagnosed if the value is between 130 and 199. This is diagnosis with prediabetes. When the hemoglobin A1C, the test gives you an idea that your average blood sugar levels are in the past 2 or 3 months. It can be taken at any time and do not require fasting or recent meal. A normal result is less than 5.7, and the prediabetes is diagnosed if the result is 0.57 between 0.57 and 6.4. Treatment. The treatment for prediabetes is about lifestyle change. People with prediabetes are encouraged to make change their diet and exercise routine, which can completely reverse the condition and prevent diagnosis to type 2 diabetes. About the third people who make this change successfully reverse their condition. Another lifestyles include healthy diet. There is not a specific diet plan recommended for people with prediabetes. Any diet that reduces the amount of calories, carbohydrates, and that it is effective. Physical activity. That is also flexible and can be sampled as going to walk every day. The EDA recommend a mean for 150 minutes for the exercise per week. Weight loss. Research has shown that you need to lose 7% of your body weight to have a significant impact in your blood glucose levels. Treatment always starts with a consistent diet and exercise routine. But if your blood glucose levels remain elevated after this change, your provider may consider prescribing any medication called metformin. It's common oral medication prescribed to people with diabetes. But research has shown that this can also help reverse prediabetes. What is diabetes type 2? If you have prediabetes, you can reduce your risk to develop type 2 diabetes by doing the following. Losing a small amount of weight and overweight, grading regular physical activity, losing a small amount of weight loss means lost 5 to 7% of the body, and take 30 minutes a day to walk. National Diabetes Prevention Program led by CDC can help you make those changes and make the last. Through program, you can reduce your risk developing type 2 diabetes by 58%, 71% if you are over age 60. Ask your doctor if you have any CDC recognized diabetes prevention program offered in your community. If not, research. The best time to prevent diabetes type 2 is now. If you have any concerns about your prediabetes or you diagnosis with prediabetes in the past, you had to see the doctor to prevent the symptoms and diabetes type 2. Ask about your glucose screening and you have the risk factors for diabetes.